This is Dr. Andrew, and he is an emergency room physician. And this is an important video because I hope that it will help foster research on a mechanical type of back pain in which motion is blocked when you do passive springing on each quadrant of the sacrum and under the ILA. And in this example, his left lower quadrant did not have any mobility with passive force transmission testing or thrusting or spring testing, and he didn't have any superior mobility, and that is doing these tests with a reasonable amount of force and a measured amount of force, and this clinician has been doing those tests for 40 years. So I'll let him tell his story.
My name is Andrew. I'm an emergency physician by trade and pretty active in skiing, hiking, biking, things like that. I had an acute injury in 2019 with a herniated L5-S1 disc, and I went through the typical recuperation, immobilization, splinting, and physical therapy afterward. But I was left, even after the disc healed radiographically by MRIs, I was left with an inability to sit and extreme discomfort sitting that was greatly limiting my social life and personal life, and even affecting my job because I had to stand for 8 and 9 hour emergency department shifts, never being able to sit and take weight off my feet. So thankfully I found Dr. Hesch, and I live fairly close by here in central Colorado, and I'm only 3 days post-treatment now. After the testing for sacral torsion, my tests were positive. The maneuvers that Dr. Hesch did to mobilize or correct that maneuver were pretty immediately effective. I no longer had a sensation that something was stuck in the sacral region. I was able to sit immediately without discomfort, and several days later had no return of my symptoms or problems, and I was doing workouts at the gym and things like that, which maneuvers which I would expect to have precipitated symptom return. Last night I even attended a music concert with a lot of sitting in a folding chair, and I was quite comfortable, and I would not have been able to do that over the past, it's been over 2 years since I've been able to do that comfortably. So that speaks to both the diagnosis and the methods Dr. Hesch uses.
And how long were you unable to tolerate sitting? That goes back
before
to 2019?
Yeah, before my injury, the disc herniation, I was fine. Flying long flights, sitting on a bike seat,
okay,
sitting for dinner, never had a problem with that. And I had the disc herniation, which was precipitated by lifting some bags of mulch, leaning into a vehicle, a few things compounded in a short weekend trip to Texas. And by the flight home from Texas, I had to sit propped up off of the airline seat. I couldn't take any axial loading on my spine at all. I had to sit, I think it was a 2.5 hour flight or 3 hour flight, completely holding myself off the seat, and I was in agony. So since about that time, I've not sat comfortably, but I attributed it to the disc injury. But then even after a normal healing period, I continued to have the problem. And
the MRI was then clear?
MRI was improved. I didn't even mention the previous disc herniation. And I saw two different spine surgeons, several physical therapists, pain specialists, and every time I would mention, I can't sit, there has to be a clue here. I even did my own medical literature searches to the limited degree I could about problems sitting. And I never had any satisfactory solutions, nor diagnosis. I continued to do strengthening PT, which I thought would eventually get me out of this disability, but it never really did. I did 2 years of twice weekly, core workouts, part yoga, part Pilates, and I feel quite strong in my core, but it never came close to fixing the problem. So
how many minutes did the correction take the other day?
I think 2.
2 minutes. It was 2 minutes of constant
Right.
applied
Right.
force. And if it really does involve that SI joint, and nobody knows, then I would submit that it's going to take a while of constant applied force to actually get that to move, because it's such a powerful joint. And we know that you've had lots of manipulations that
Right.
never gave you that sense of freeing up what felt stuck.
No, and I've had I've had that sensation of joint movement with chiropractic manipulations and certain PT moves and things I've done on my own. So I would get movement in the region, thinking, well, okay, that area is mobile now, but it clearly wasn't the same mobility that you were able to achieve. So it wasn't the same type of manipulation by any means.
Very good. And we certainly need more basic and more clinical research on this kind of a presentation. And I even hate to call it a sacral torsion, but so far that's the language we have. I've modified it a little bit, and what I would call your presentation is a left lower sacral quadrant, prominent in sitting or in flexion and even in prone neutral, prominent and stuck because it doesn't translate that spring mobility, and also your left ILA presented as inferior and lacked superior spring mobility, whereas there was mobility on the right. And that's a more general description, and it acknowledges that maybe some of this is outside of the SI joint. Maybe it's the entire pelvis just kind of reorienting and pulling on muscle and ligament, and maybe the lower lumbar facets are also involved with this oblique positioning. We don't know. We don't have the basic research to tell us it is or it isn't or what this is. We just know that it really was helpful to you. And I'll take that. And of course I taught you how to self-treat it, so I don't think you'll ever have to see me again.
Okay, well that would be fantastic. I mean, I'd love to see it. I'm not that far away, but yeah, that also speaks to the effectiveness of the treatment, that it doesn't have to be reset every day or 3 times a week for 12 weeks to, which a lot of treatments would sort of prescribe, and so that says a lot also. Yeah, I had this sensation that something was stuck, and I no longer have that sensation. That's the only way I could really describe it.
Well, I'm glad you're better, and I think that we'll see more progress. We did a intake oswestry score with you, and then we did one again today. We didn't have to treat you today other than me showing you some simple exercises, body mechanics, things like that, and the self-treatment for torsion. So now you know how to keep it at bay. If it should ever recur, that simple self-treatment, we have YouTube video on it, should resolve it without you needing to see me. I had a train of thought and then I got derailed, so I'll leave it at that.
Yep, well, thank you again.
Yeah.
Really appreciate it. I'm looking forward to returning to a function.
Very good, and we'll do a follow-up in a week or two, and then a 4-week oswestry.
Okay.
Thanks. Thank you so much.